Ready when you are. Come on in. Hello, Mrs. Patterson. My name is Nicole. I'm going to be your nurse today.
Hi, Nicole.
Are you in any pain at all right now?
No.
So we're going to be doing a head-to-toe assessment today. So I'm going to be asking you to do a couple different things, and I might need to listen to different parts of the body. But what I start with is orientation. So could you tell me first your full name and your date of birth?
Yes, my full name is Anne Marie Patterson, and my date of birth is 1/10/1964.
Perfect. It matches your wristband, so that's great.
Oh, good.
Could you also tell me where you are today?
I am in the hospital.
Yep.
Okay. Why?
You're just here
For a
for a
checkup?
regular checkup.
Okay.
Yep. Okay. And could you also tell me the time, like what date it is today?
Today is December 8th.
Very good. Okay, so that's great. You're alert and oriented to person, place, and time, which is great. And your speech is clear, which is very good as well. Now I'm going to be assessing your scalp, if you don't mind.
No, go ahead. You want me to take this out?
No, that's fine. If you could just lift your head up a little bit. Perfect. So your scalp is dry, and I'm not feeling any weird like bony prominences in your skull. Your hair is evenly distributed, and it's not too coarse. It's like a good texture, so that's all good. Next, what I'm going to do is check your eyes.
Okay.
So I'm going to be shining this
Take these
light.
off?
Yep, please take your glasses off.
Okay.
I'm just going to be shining this light in your eyes, but it'll be over in a couple seconds, okay?
Okay.
So what I'm checking for is how your pupils accommodate to light.
It's kind of bright.
I know, sorry, one more time.
All right.
Look forward, look straight ahead.
All right.
Sorry.
That's okay.
Okay, good. Your eyes are equal and reactive to light.
Can I put these back on?
Yes, you can put those back on. So next, what I'm going to do is test your eyes for nystagmus. So that means when your eyes are kind of like fluttering a little bit. So follow the tip of this pen light for me.
Yep. Would it be easier if I take these off? No.
I can see through it. It's fine. All right, so there's no nystagmus in your eyes. Now the last one, can you look at the tip of this?
Oh, my bifocals are going crazy. Hold on, I'll do it again.
Okay, one more time.
Yeah.
Right on the tip. Perfect. Okay, so your eyes accommodate to that, so that's good.
Yep.
Next, what I'm gonna have you do is I'm gonna look inside your mouth.
All right.
So ready? Say ah. Okay, so your uvula goes up symmetrical, so that's good. And then your tonsils are a little bit showing, but they're not occluding the airway at all, so that's perfect. They're about like a +1 on that. Next, I'm gonna just palpate your sinuses, if you don't mind.
Take these off again?
Yep.
All right.
And just let me know if it feels like tender at all right here. No?
No.
Okay, your nose is symmetrical, which is good.
Your hands are cold.
I am sorry. So now I'm gonna feel your lymph nodes while I'm here. Okay, so let me know if anything is sore. So this is your tonsillar lymph node, your submandibular, submental, interior cervical, posterior cervical, preocular, postocular, occipital, and then your last one is going to be right here on your subclavicle. Good, so I can't feel that one, so that means it's normal. Usually when you can feel it, that means that there's something going on there. Next I'm going to inspect your ears.
Okay.
So your skin is intact on your ears, which is good. No lesions, and your your skin is intact, it's dry, no lesions. Your other ear, skin is intact, no lesions. Okay, so now I'm going to do the whisper test. So I'm going to have you first cover your right ear, and I'm going to whisper something behind you, and you need to repeat it for me, okay?
Yep.
4J.
4J.
Yes. Okay, now cover the other one.
Okay. 3K.
Yes, very good.
I thought you were going to give me some words to say.
No, sorry. Speaking of words to say,
What?
for your, I forgot to do this at the beginning, but for your orientation exam, I'm gonna give you 3 objects, and then once we're done the whole head to toe assessment, I'm gonna have you repeat them to me at the end. So the 3 objects are gonna be, let's see, boots, flowers, and dog.
Okay.
Okay. So I'll ask you at the end.
Do they have to be in that order?
It doesn't matter.
Okay.
Just if you remember them or not.
All right.
Okay, so I did your ears. Next I'm gonna palpate your trachea right here.
Okay.
Okay, so that's midline, that's good. Now I'm gonna do your thyroid, so I'm gonna press on one side,
Okay.
and you swallow if you can. All right, ready? Swallow. Okay, good. Now one more time if you have enough spit. Good. All right, so your thyroid is normal size, it's not too big or too small. Next what I'm gonna do is listen to your heart sounds. So if you could lean back for me.
Lean back. All right.
Yep. Thank you. And I might just have to put this under your shirt if that's okay.
Yep. If you can't hear.
What? Yeah.
If you can't hear.
And normally I would raise the bed in this process, but the chair doesn't really raise, so I'm gonna have to be bending my back a little bit, but
Okay, that's fine. No.
so this is your aortic. Pulmonic. Herbs point. Tricuspid. Okay, and then last one, I'm just gonna go like this. This is the mitral. Okay, perfect. And then also while I'm right here, I'm gonna have you breathe in and out.
Okay.
Test your breathing sounds, so. Good. Perfect. Now, you just lift it up. I'm just gonna do one down here. Okay, one more right here. Okay, perfect. Okay, so now what I'm gonna do is check the skin around your arms. So, yep, your skin is intact, it's dry, no lesions. You can feel a radial pulse, which is good. Now can you make a fist and wiggle your fingers? And then also kind of cross that arm over. Yep, and then up, and then down. Perfect. And then for this one, again, the skin is dry, it's intact. You have a radial pulse, which is good. You're just going to do a capillary refill. And that's less than 3 seconds on your left hand. Less than 3 seconds on your right hand. And then can you do the same range of motion? So cross, or yep, up, and then down. And then your wrists, your fingers. And then I forgot to do the neck one, but could you put your chin to your chest?
Yes.
And then back, if you can. Yep, and then side to side.
Yes.
Perfect, okay. So next what I'm gonna do is listen to your bowel sounds. So would you mind if I listen to your stomach?
Oh, that's fine.
Okay. So, well, first I should inspect it. If you don't mind. Okay. I'll just do it over, it's fine.
That chair creaks.
I know. So your skin is warm and dry. I'm not seeing any distension, which is good. So I'm going to listen in all 4 quadrants.
you hearing anything?
Alright, so I heard normal vowel sounds in all 4 quadrants. I'm just going to palpate it real quick.
Go ahead.
Wow. So the skin around here, I'm not sure if I said it already, but it's dry, it's got good, no lesions or anything. So ask me, or tell me while I'm pushing if you feel any pain. No? It just feels weird.
It feels weird.
Yeah.
But no pain.
But no pain?
No.
Okay, that's good. Alright, so I don't need that anymore.
Okay.
Actually, while I'm here, I'm just going to do your skin turgor. That's good. Good, no tenting. I'm going to check your legs. Your legs are warm and dry. There's no lesions. You don't have any edema. Do you mind if I take your socks off? Okay. Okay, so I'm going to feel for your pulses. Good. Good. And good, so you have pulses in your dorsalis pedis and your posterior tibia.
Hospital cat.
Yep. Animal-friendly hospital. Now I'm going to check your your capillary refills on your feet.
Yep.
And that's good. Under 3 seconds. And no edema. Good. Okay, so now could you bring your knee to your chest?
Yes.
Yep. And then cross it over. Good. And then bring it out to the side. Yep. Okay, so this one, can you bring to your chest?
Yep.
Good. Out to the side.
Yep.
And back. Good. Now can you push your feet against my hands?
Yes.
Perfect. Alright. Can you pull them back up against my hand?
Yep.
Good. Okay. And then grab my hands as hard as you can.
Grab them.
Grab.
Okay.
I'm testing your strength.
Go. Yep.
Okay.
Yep.
So I think you can grip harder, but you're just not doing it. There you go. That's better.
Okay. I thought you
Okay.
were gonna pull.
No, I'm just testing your grip strength. Okay, so put your socks back on. Alright, then after this I'm going to have you sit in the chair so I can
Okay.
listen to your back respiratory sounds. So put that down.
That's good.
Yep.
Alright. Now right here.
Yep. Or actually I could pull it over so we don't have to. Alright, so if you could sit right there. Okay, so first thing I'm going to have you do, oops, sorry, that was a big shock. Could you lean over just slightly? Maybe a little bit like that, yeah. Now can you take a deep breath for me? One more time. Okay, good. So you have equal expansion on your lungs on both sides, which is good. Next, I'm gonna listen to your lung sounds from your back.
I just gotta chill.
Got an itch?
Yes.
All right. So deep breath. Good. One more. Perfect. So your back, skin on your back is dry. There's no skin lesions, and it's intact. Also, your respiratory sounds from your back sounded good. Next, what I'm going to have you do is stand up and touch your toes.
Oh boy. Okay.
I'll move this out of the way.
All right. Stand up and touch my toes. All
I'll
right.
go
That way.
right behind you. Yeah,
Right
like
this
that.
way.
Yep. Okay, so your spine is aligned, which is perfect. You don't have scoliosis, and it feels normal.
Okay.
All right, next thing I'm gonna have you do is just walk to the end of that couch and back.
walk. Okay.
Yep.
And then come back.
Yep, and then come back.
Okay.
Perfect. So your gait is steady, which is good.
Yep.
Now, could you tell me the 3 things I told you at the beginning?
Boots, flowers, dog.
Good.